I want to tell you about a ritual that happens in medical graduate WhatsApp groups across the country. And this happens every single day. Someone sends a message, has anyone seen anything new on internship posting? And then 20 people reply, nothing yet, still the same. Another will reply, been checking since morning. And of course, the conversation ends at that particular point. And tomorrow, the same message is sent again. And the day after. And of course, the week after. I understand why this happens. The government posting is the most visible, most talked about, most culturally central opportunity in the healthcare graduates world. At that particular point is where they begin their journey of professionalism. And so it becomes the entire horizon and the only thing that they think about, the beginning and the end of the opportunity search. And here is what I want you to understand today. The government posting is one door in a building that has many doors, most of which are unlocked, most of which very few graduates are even trying to access. And behind some of those doors are opportunities that are more interesting, more immediately available, more aligned with where you actually want to go than anything currently on that portal or posting or internship posting. So today we open those doors and we're doing so one by one. Welcome back to After Campus series. This is episode 14 of and it's in week 3. We've had a remarkable few days. On Monday, or the first episode of week 3, we looked at the foundation of networking and what it actually is. If you haven't watched that video, please go to the playlist After Campus and you'll find the video. The second episode of week 3, we looked at how to approach senior professionals without feeling like a burden. And then thirdly, the third episode of week 3, we looked at how to build it, how to use it, and how to let it work for you. That is LinkedIn. And today we go somewhere that I think will be one of the most practically useful conversations of this entire series, where the opportunities actually are. Not the obvious ones, but all of them. Because one of the most consistent things I hear from medical graduates is this: I don't know where to look. And the gap between the opportunities that exist and the graduates who need them is not a talent gap. That is not the gap. It is an information gap. And today we close that gap. We close that information gap. And I want to tell you about a graduate I will call Jerome as a way of beginning the series. Now, Jerome, or this episode, Jerome qualified as a medical laboratory scientist. Strong academically, highly motivated, ready to work, of course. And for the first 8 months of his pre-internship period, he did what most graduates do. He monitored the portal for internship placement. He asked around. He waited. And then one afternoon, not because he had a plan, but because he was bored, he sat down and started Googling. Not the portal to check for placement, not the Kenya Medical Laboratory Scientist Board, the board that regulates them. He started Googling organizations working in health in East Africa. Talk about research institutions, international NGOs, local health foundations, global health agencies. And what he found over 2 hours of searching that felt more like falling down a rabbit hole than doing research changed everything he thought he knew about where opportunities lived. So he found a research institute he had never heard of, running a study on infectious disease surveillance. That was actively looking for laboratory science graduates to assist with simple processing and data collection. Not advertised on any jobs board he had ever checked. Now, he found on the Institute's website, he found the opportunity on the Institute's website under a tab called Opportunities that he had never thought to look for. He applied, he got a response within 4 days. He was invited for an interview within 2 weeks. And within a month of that afternoon of aimless Googling, Jerome was working, not waiting, but working in a role that paid him, built his CV, developed his technical skills, and of course connected him to a network of researchers and public health professionals that he is still drawing on today. Now, the opportunity was not new when Jerome found it. It had been there. It had been open. It had been waiting. He just had not known where to look for it. And that is the story of most opportunities in African healthcare. They exist, but they are not always where people are looking. The opportunities are not always where people are looking. Today, I'm going to tell you exactly where to look for those opportunities. Before I walk you through the opportunity landscape, I want to spend a few minutes explaining why the government internship dominates so much mental real estate for health graduates and why that dominance is costing people opportunities they don't even know exist. First, the internship posting is what your training pointed you toward. Throughout medical school, pharmacy school, nursing school, the internship was the destination. The posting was the gateway. And when a system trains you for 6 years toward a single destination, you spend 6 years developing tunnel vision. Not deliberately, not inevitably, and that tunnel vision doesn't disappear the moment you graduate. It persists. And it filters out everything that isn't on the portal as somehow not real, not legitimate, not the real career. Even when those other things are paying, skills building, network creating, CV enriching opportunities, it still doesn't add up. Secondly, the opportunity landscape in African healthcare has expanded enormously. It has over years, it has expanded enormously. 20 years ago, the pathway for a medical graduate was genuinely narrow. Government service, mission hospitals, and a handful of private facilities, of course. And the government posting was not just the most important door. It was essentially the only door that existed at that point. But that landscape has since transformed. Now, global health has grown into a major employment sector. International NGOs and development organizations have massively expanded their presence in East Africa. Research institutions, both local and international, are running more studies than ever before, and they need local health professional graduates to run them. The pharmaceutical industry has expanded its operations in Africa significantly. Talk about health technology is creating entirely new categories of work. Social enterprise in health is also growing. The opportunity landscape is wider than it has ever been. But because most graduates are still looking at the same narrow slice, the rest of the landscape sits almost untouched. Thirdly, many of the best opportunities are not publicly advertised. And this is perhaps the most important thing I'll say today. A significant portion of the most interesting opportunities in African healthcare talk about research positions, fellowship programs, NGO roles, industry openings are filled without ever appearing in a public jobs board. And they are filled through networks, through referrals, through people who are already in the right rooms, which is why everything we talked about in episodes 11, 12, and 13 was not abstract preparation. It was direct preparation for this. Because the person with a strong professional network, who is visible on LinkedIn, who has built relationships with senior professionals, who shows up at forums and stays in contact, hears about these opportunities first, or is recommended for them by someone who already knows their work. Now, the person who is only monitoring the portal never hears about them at all. Now, I want us to look at something interesting, and this is what I call the opportunity map. And I want to walk you through 7 categories of opportunity. Each one is real. Each one is currently accessible to health professional graduates in Kenya and across East Africa. And for each one, I want to tell you what it looks like, who it is for, and how to find it. Category 1 is the government and public sector. Yes, the internship portal is relevant in this particular point, but broader than most people think. Beyond the internship posting itself, county health departments hire health professionals for community health roles, health promotion, school health programs, and environmental health. Now, the Ministry of Health runs various programs that recruit health professionals at different levels. The Kenya Medical Research Institute, that is KEMRI, regularly recruits research assistants, field officers, laboratory personnel, and data managers. The Kenya Medical Supplies Authority, or KEMSA, has procurement, quality assurance, and supply chain roles which are relevant to pharmacy and lab graduates. Now, the Kenya Revenue Authority, the Kenya National Bureau of Statistics, the various government commissions occasionally recruit health professionals for health economics, health data, and policy role. Public hospitals and referral facilities sometimes hire health professionals in administrative, quality assurance, and health records roles. How then do you find these opportunities? Beyond the main portal is where these opportunities lie. Monitor the websites of individual government agencies. Follow the Public Service Commission of Kenya website. Join professional association mailing lists. They circulate government opportunities that don't always make it to the main portal. Category 2 of opportunities: international NGOs and development organization. Now, this is the category most graduates completely overlook, and it is one of the most opportunity-rich spaces in East Africa healthcare right now. Organizations operating actively in Kenya and East Africa include the following. We have what we call Medicine Sans Frontiers, MSF. They run clinical programs and recruit health professionals at various levels. Of course, we have AMREF Health Africa, which is headquartered in Nairobi, one of the largest African health NGOs. It recruits across clinical research, program management, and community health functions. Population Service International, PSI. It works in reproductive health, malaria, HIV. They regularly recruit health professionals. IntraHealth International, which works in health workforce development. It recruits health professionals for program and training roles. We have Management Science for Health, MSH, which works in health system strengthening. It recruits across pharmacy, clinical, and health management functions. Living Goods is another one. It's a community health program. It recruits nurses, community health workers, and health program graduates. Japaigo, which focuses on maternal and reproductive health. It recruits midwives, nurses, and clinical officers. We have PATH, which is a global health innovation organization. It recruits health professionals, researchers, and health technology specialists. How to find these opportunities? Each organization has a careers page on their website. Check them regularly. Set up Google alerts for those organizations or NGOs and follow these organizations on LinkedIn. They post opportunities there and they do so regularly. We have Relief Web and DevX, which are two platforms that aggregate NGO and development sector jobs globally with strong East African listings. Category 3 is the research institutions. And now this is Jerome's door, the one he found by accident, the one most graduates never think to try. Now, research institutions in Kenya and East Africa are running more studies than at any point in history. Talk about clinical trials, epidemiological studies, health systems research, implementation science, community health research. And they need local health professional graduates to run them, not just as lab technicians, as research assistants, field supervisors, data managers, clinical research coordinators, community health liaisons, sample processors, research nurses, research pharmacists. Now, we have key institutions to know if you intend to step into this space. One being KEMRI, which is Kenya Medical Research Institute. Now, they have multiple research programs running simultaneously. We have APHRC, which is African Population and Health Research Center, based in Nairobi. It runs social and health research across Africa. We have ILRI, International Livestock Research Institute, which runs One Health research relevant to veterinary and medical graduates. We have KEMRI, Wellcome Trust Research Program, one of the largest clinical research programs in Africa, which is based in Kilifi and also in Nairobi. We have Aga Khan University, which runs research programs across East Africa. It recruits research staff at multiple levels. University of Nairobi, of course, research departments. We have the individual departments often have ongoing studies that need research assistants. We have Strathmore University, which is a business school, health research in public and health economics research. How then do you find these opportunities? Go directly to the careers or opportunities pages of each institution. Contact the principal investigators of specific studies directly. Their email addresses are often on published papers. Check clinicaltrials.gov for studies registered in Kenya, and the contact information for the research team is on the listing. You can also check LinkedIn, follow those institutions and turn on notifications. Category 4 is where we have the pharmaceutical and health industry. We have a full episode dedicated to pharmaceutical careers coming in week 4, but I want to map it here as part of the full opportunity picture. Pharmaceutical companies operating in Kenya and East Africa include local manufacturers and international companies with regional offices. Talk about Abbott, GSK, Pfizer, Novartis, Sanofi, Roche, AstraZeneca, J&J, Cipla, Shelley's, and they hire health professionals not just as medical sales representatives, though those roles exist, but as medical affairs associates, pharmacovigilance officers, regulatory affairs assistant, medical science liaisons, clinical research associates, quality assurance officers, health economics analysts. How then do you find these opportunities? There are career pages on each company's website. LinkedIn, follow the companies and the people who work in those companies. Talk about Pharmacy and Poisons Board of Kenya. Sometimes it publishes regulatory affairs roles that you may want to apply. Category 5, talk about the Fellowships and Scholarships Program. The Fellowships and Scholarships Program. And this is the category with the highest upside and the lowest application rate from qualified Kenyan graduates, because most people either don't know these programs exist or assume they are for someone more impressive. They are not. They are for people exactly like you. Now, key programs that you may need to know include the following: the African CDC Fellowship programs, rotating fellowships in public health, disease surveillance, and health security. We have WHO African Regional Office Fellowships, which are placed in WHO country offices across the continent. We have CDC Global Health Fellowship programs, what we call DGHT fellowships, which place health professionals in CDC-funded programs. We have what we call Fogarty International Center, NIH, which is a research training fellowships for health professionals from low and middle income countries. We have Commonwealth Scholarship and Fellowship Plan, postgraduate scholarships for health professionals from Commonwealth countries. We have African Union Commission Fellowship Programs, which is health sector specific placements. We have USAID funded leadership programs for various leadership development fellowships for African health professionals. We have Aga Khan Foundation International Scholarships, which are available for postgraduate study with a strong health sector component. We have East African Community Health Fellowships, which is placements within East African health institutions. We have local fellowship programs for Kenya, specifically Kenya Health Policy Plus, Kenya Medical Association Young Professional Programs. And how then do you find this? Maintain a fellowship tracker spreadsheet. Set annual reminders for application windows. Most fellowships open at the same time each year. And then follow Global Health Fellowship aggregator accounts on LinkedIn and Twitter. Then, or X, nowadays it has changed to X. Then subscribe to the Global Health Jobs newsletter, which aggregates fellowship opportunities weekly. Join alumni networks of these programs. Members often share opportunities with their communities. Category 6 is a faith-based and mission health organization. And this is a category that is particularly rich in Kenya and East Africa and almost completely invisible to most graduates who are searching digitally. Now, faith-based organizations run a significant proportion of health facilities in Kenya. And the Kenya Conference of Catholic Bishops that is KCCB, it runs hundreds of health facilities. The Kenya Christian Health Association, KCHA, it coordinates Protestant mission hospitals. The Aga Khan Health Services Kenya, the Hindu Council of Kenya Health Programs. Now, these organizations regularly need health professionals at various levels: clinical officers, nurses, pharmacists, laboratory scientists, nutritionists, health administrators. And because most graduates are not applying to them, competition for these roles is significantly lower than for government posting. How do you find these opportunities? Contact the secretariats of KCCB and KCHA directly, and contact individual mission hospitals in counties where you are willing to work. Many of these facilities have Facebook pages rather than formal websites, and checking their social media is sometimes the most current source of opportunity information. Category 7, talk about the social enterprise, health technology, and entrepreneurial opportunities. Now, this is the newest and fastest growing category, and the one with the most potential for health professionals who are willing to think creatively about how their skills apply. Health technology companies operating in Kenya include the following: Flare Emergency Response, we have Ilara Health, Jacaranda Health, we have Maidawa, Pharma, Helium Health, Visita. Now, these organizations are building the digital health infrastructure of Africa, and they need health professionals. They do need health professionals, not just technologists, but they need clinical advisors, medical content creators, health data analysts, clinical operations managers, customer success managers with clinical backgrounds. And social enterprises in health include organizations working in community health, organizations working in health financing, last mile drug delivery, and health education. How do you find these organizations, opportunities in these organizations? You follow the Kenya Health Innovation Hub, follow the Nairobi Startup Hub and Nairobi Garage. Many health tech companies are in their communities. You also can use LinkedIn and you search for health technology companies in Kenya and follow them. You can also check the East African Health Innovation Hub at Strathmore, and they work with health innovators and sometimes have embedded fellowship opportunities. And I want to give you a system, because knowing where the opportunities are is one thing, but consistently monitoring them without it taking over your life is another thing entirely. And here is a simple system that works. First, build your opportunity tracker. Could be a simple spreadsheet. Use Excel. 7 categories, matching the ones we just went through. For each category, a list of specific organizations or programs to monitor, and the opportunity URL or careers page link, you have to include it there. A column for last checked, you can also include. A column for any active opportunities noted, you can also include that. And then review this tracker once a week. Review it once a week, not once a day. That is quite exhausting, but once a week is manageable and it can take you 30 minutes. Then do it systematically. This is a simple habit, but maintained over the pre-internship period means you will never miss an opportunity because you didn't know where to look. Secondly, set up Google Alerts. Go to Google Alerts. Set up alerts for health jobs in Kenya, Research Assistant Kenyan Health, Global Health Fellowship East Africa, NGO Health Vacancies Kenya. Your specific field, set it as an alert. Now, these alerts will deliver relevant opportunities directly to your inbox. You will not have to be looking. They will come to you. Thirdly, follow the right people on LinkedIn. We talked about LinkedIn in the previous episode. Follow the right people. As we had discussed, LinkedIn is where many opportunities are announced informally before they appear anywhere else. Follow the HR accounts of the organizations on your tracker. Follow senior professionals in the fields you are targeting. Follow the accounts of fellowship programs and global health organizations. Then turn on notifications for the accounts that matter most. And check your LinkedIn feed once a day with specific intention, not passive scrolling. active opportunity hunting. Fourthly, make one direct inquiry per week. Make one direct inquiry per week. And that is beyond the online monitoring. You reach out to one organization directly every week. Not a formal application, but a brief professional inquiry. I'm a recent graduate with a strong interest in this area. I would love to know if your organization has any current or upcoming opportunities for someone at my level, or if there are ways I can contribute in a voluntary capacity while I await my internship placement. That is a sample message that you can send an organization. Now, most organizations will not have an immediate opportunity, but they will remember you when one arises. And sometimes, more often than you would expect, they will create something for a person who showed up proactively and made a good impression. Now, I want to say something about opportunity that I think is counterintuitive and that I believe deeply. The best opportunities I have had in my career were not ones I found on a job board. They were not the ones I found on a job board. They were not ones that came through a formal application process. They were ones that came through relationships, through showing up, through being known in spaces where things were happening, through someone thinking of me when a gap appeared in an organization where they were working, or someone asked them about someone they could recommend, because I had made sure they knew I existed and what I cared about. Which is why this week, networking, LinkedIn, approaching senior professionals was not preparation for finding opportunities. It was the opportunity finding system itself. Once you've built it correctly, it will work for you, because the graduates who find the most interesting, most fulfilling, most career-defining opportunities are almost never the ones who searched the hardest. They are never the ones who searched the hardest. They are the ones who built the relationships that made the searching unnecessary. I'm not saying don't search. Search actively. Use the tracker. Set the alerts. Make the inquiries. But do all of that alongside the relationship building, not instead of it. Because the combination of active searching and strong relationships in a landscape this rich with opportunity means that the pre-internship gap is not a waiting period. It is not. It is a positioning period. And where you position yourself in the next 12 months will shape the first 5 years of your career. Take that seriously. Take that seriously. That is episode 14 of After Campus series. Before you go, 2 things I'll ask of you to do for me. Move to the comment section, and I want you to tell me which category from today's opportunity map is the one you had never considered before, the one that opened something for you. Drop it below, because your answer is going to show another or other people in this community a door they didn't know existed. And that is exactly what this series is for. Secondly, it's about the next episode, that is episode 15. The week 3 finale, and it is the most immediately actionable episode of this week, or the week 3. And you're talking about how to apply specifically, how to write a cover letter that doesn't sound like everyone else, how to cold email someone you have never met and actually get a response, how to follow up without being annoying, and how to ask for a recommendation letter in a way that produces a strong recommendation letter, not a generic one. Now, everything you need to go through, to go from knowing where the opportunities are to actually getting in front of the people who control them, that episode drops tomorrow. Do not miss it. I will see you then. This is Dr. Libea Bethwell, and this is After Campus series.